My name is Anna. I'm from Austin, and I've been a NICU nurse for 20 years. So NICU stands for Neonatal Intensive Care Unit. So we deal with a wide range of babies, some born premature as early as 22, 23 weeks. We also deal with term babies experiencing things like respiratory distress, hypoglycemia, which is low blood sugars, and a bunch of surgical term babies as well. I always knew I wanted to be a nurse and help people. I wasn't sure which specialty I wanted to go in. I did a rotation in the NICU in college and fell in love with it. The NICU babies, they're the most vulnerable population. They don't have a voice to speak for themselves, so I wanted to become a NICU nurse to help them. The best thing in the world is to see a very sick baby born and then stay with us sometimes 4, 5, 6 months, and then we discharge them home to their families. And seeing them walk out the door, they get to ring a bell when they leave the NICU and go home as a family. That's so rewarding. We've seen a lot of rules and regulations change most recently here in Texas in the past couple years. One of them with the clinics closing for women's health care. I'm seeing how these laws and new legislation are negatively impacting women here in the state of Texas. We see a lot more women who aren't seeking prenatal care or they don't have access to it. So conditions that we had not seen 10, 15 years ago that are preventable with adequate prenatal care, we're seeing a resurgence in that. So we're having to refocus and reshift back to those conditions. There's a lot of conditions that require close monitoring early on. For example, a mom with very high blood pressure, they could be on medicine that could be prevented. And a woman with high blood pressure can have very, very tiny babies. They can be very, very sick and born early. So that's something that could be entirely prevented by receiving adequate prenatal care. We have a lot of babies born with defects that we could have helped prevent or known about before. We've also seen babies that are born with conditions that are unfortunately incompatible with life. Oftentimes, those mothers have other children as well. So they're in the hospital trying to get care, and their other children have suffered with their moms not there. As a healthcare provider here in the state of Texas, with the changing legislation over the past few years, it's been a challenge to navigate that. You know, we do our best for the mothers, the patients, the families in a whole, but it's complex. It's hard to know exactly what the laws are as they continue to change, but we do our best to give our best care to these families. It's really difficult to see these women who are sitting back there with becoming septic and these babies dying. I'm a mother to 2 sweet children, a woman, and a healthcare provider. I cannot imagine seeing what I see going through that myself, having a miscarriage and not getting the care that I need and having my family suffer with that. I can't imagine being away from my children and not receiving the adequate health care that a woman needs. It's unimaginable, unthinkable. As we see more women coming in carrying babies that have, unfortunately, conditions, congenital anomalies that are incompatible with life, you know, the care for the babies aren't changing, but we are more family-centered focused now. We're focused on the moms, the dads, the families, and it's kind of like providing grief counseling. And as much support as we can give to these families, I've noticed a big difference, and that's more of what we do now. We work tirelessly and endlessly to save these babies' lives and protect these families from any more harmful situations than they have to go through already. But it's very emotional. It's very, very hard, you know. A lot of us women, we empathize and with what these women are going through and how hard it is. The NICU stay is very long, and it's one of the hardest challenges any family will ever have to go through. So just being part of that can be very stressful. You know, you try to leave work at work, but it affects us. We take it home with us. As a NICU nurse, what I would wish and hope for the women and families in the state of Texas is to receive the best health care that they can receive. We're giving the best care to these babies. These women deserve the best care as well.